I think the big thing is changes are coming,
Yeah.
right? It's not like previous years where there was a couple of nuances to someone's individual plan.
Yeah.
Sweeping changes are coming to Part D coverage around premiums, donut hole, max out of pocket. It is not the year to sit on your hands and not review your coverage. Well, welcome to the Inside Connection podcast. I'm Lance O'Brien, joined by Mark Clark. How you doing?
I'm great. Excited as always, ready to go.
Yeah, we got to be excited to go this time of year, huh?
Yeah, we're on the eve of AEP, right? The annual enrollment period. Lots of changes this year. Medicare is confusing as it is, and now Medicare decided to change itself. So,
yeah, I think the thing that's really interesting is over the last 5 or 6 years, all the changes have been pretty much positive, right?
Yeah.
We've been able to come like Santa Claus on Christmas morning and be like, hey guys, this is what's going to happen. It's going to be amazing.
Yeah.
And this year there's still definitely some good changes.
Oh, yeah.
Especially for people who take some expensive medications.
Sure.
But as a result of that, there's also going to be a little bit of coal in the stocking, if you will.
A little bit.
So I think we want to spend some time today talking about just what the ramifications of that mean.
Sure. And the biggest one, the thing that everybody's excited about but a little tentative is drug coverage, right?
Yeah.
The disappearance of the donut hole.
Yeah, so I always say the great separator when it comes to Medicare is medication, right? Because all things being equal, the medical benefits are pretty much the same,
Close,
right?
yeah.
Obviously different with a supplement and an advantage plan,
Yep.
but in general, there's not major medical differences in cost.
They're relatively the same.
But once you start diving into those prescriptions, it can be different. And as you said, the donut hole is going away. And,
Yeah.
you know, the joke I've always made historically is the donut hole is the one thing we don't, that's the one time we never like donuts,
That's it.
right? You know,
That's it, yeah.
So we're getting rid of the donut hole. That is going away.
Right.
Which what that means is people aren't going to be paying as exorbitant amounts of money out of their own pocket for their prescriptions.
Right. There's a cap now. So that's a great thing. There's a $2,000 cap for 2025. And what else is going to happen, though, with the donut hole change? What else could you tell us about that?
Yeah, so again, that cap's getting instituted, and the reason for that is because of the Inflation Reduction Act, right? That was implemented to kind of step in some phases to Part D. And the big changes, there's a couple big changes. So let's talk about the ones with prescription drug plans first.
Yeah.
So again, if somebody has original Medicare and then they have a standalone drug plan, the one thing that they're going to see is less options.
Yeah. Yeah.
Right. So let's talk about it this way, Mark, because I think this will make it really understandable for people. If they're lowering the drug costs that people can pay down to $2,000, somebody has to pay for the difference of that. Is the insurance company going to pay for all that?
No, they're not going to eat it.
Is the federal government going to pay for all that?
No, they're not going to eat it. Nope.
No. So that's kind of going to be getting spread across multiple people, right? And because of more absorbed costs, the prescription plans, there's not going to be as many to choose from.
Right. Those standalone PDPs, prescription drug plans, there used to be maybe a carrier would have 2 or 3 or 4. Now they might have 1.
Yeah.
So there won't be a lot of options. There were some low cost monthly premium ones. Now they're going to be a higher cost, and drug coverage is going to be different. Do you know how it's going to affect the drug coverage?
Yeah, and before we jump into that, I do want to come back to something you just said about premium differences, right? Because we've seen over the last few years 50-cent plans, $5 plans, $9 plans.
Right.
I know one of the plans is going from about $9 to $45.
Okay.
That's a pretty big increase, right? So like for someone who's used to paying that lower cost, that's pretty impactful, right? So we know that there's going to be less plans to choose from,
Right.
higher premiums,
Right.
but there's also going to be copay structure changes, right? It used to be Tier 1 was a copay. Tier 2 was a copay.
Right.
3 and 4 were copays.
Right.
And then Tier 5, the specialty meds, the really expensive ones, were co-insurance. Now this year, Tier 1 and 2 are going to be copays. What happens on most plans at Tier 3?
Tier 3 is the copay of 25%.
Yeah.
And, they said the donut hole's gone away, kind of moved it in my estimation. It has gone away because they put the cap there. Right?
Yes.
The cap, though, affects people in different ways. If you're on really high medications, like maybe some brand names, right? Then the cap really helps you because now you know that your total cost is only going to be that $2,000. Unfortunately, people that weren't even getting close to hitting the donut hole because of the cap being there now and because of the changes in what their copay structure is going to be, they're probably going to pay a little bit more. So
yeah, and I think here's a perfect example, Mark. Somebody who maybe took 2 generic medications last year or in 2024, they go into next year.
Yep.
They had their 50-cent plan. It was very affordable for them. Mm-hmm. Now they're not going to be paying 50 cents most likely anymore. They're going to have a higher premium. That's the impact that they're going to see, right?
Yep.
And then possibly, and this is why it's so important for them to sit down and talk with us or call us and we can do something over the phone, is we could actually take a minute and review their prescriptions and make sure that they're on a plan where maybe they don't have to pay the drug deductible,
right?
Or they can avoid paying the coinsurance potentially.
In most cases, there won't be a drug deductible if you're just on generics, right? So you don't have to usually worry about that. But the great thing is that's what we can do for people. I always say that the medication part of it is the most important part because people have to take their medications every day, right? So, you don't want to, there could be a difference of hundreds or thousands of dollars.
Yeah.
Depending on the plan you're on. And, we can do that work for you. In a matter of moments, we can figure out what is your copay structure? What's it going to all look like for you in 2025?
Yeah. I mean, we're not going to see our specialist every month, but we are generally going to pick up our prescriptions every month, right? And that's a consistent part of our life. So we've kind of talked about the elimination of the donut hole, how that's going to impact standalone drug plans, right? There's going to be fewer options, higher premiums across the board in general, and then we're also going to see some changes in the copay structure. Now, what about if somebody has a Medicare Advantage plan? Are they also going to feel the impact of these Part D changes?
Oh, that's a definite yes. And so, again, when a company is losing money in one area, it doesn't matter what industry you're in, you're going to try to make it up somewhere else. And these carriers, that's what they're going to do. And that we're seeing that evidence. We're seeing that there are other benefits that are getting slashed, right? We're not really, can't get into all those details, but the reality is benefits like dental, vision, and hearing are even getting affected. Over-the-counter benefits getting affected. People on dual eligible plans are seeing a lot of those extra benefits. They're going to see a lot of those get cut back, and it's going to affect you. It's going to affect what you're able to do with your plan, those extras that, most people are on an Advantage plan because they like to get that extra stuff. I like that free stuff.
Yeah, exactly. And I think the way for people to really understand it is when you have a standalone prescription drug plan, all it does is cover the prescriptions, right?
Correct.
So all of that movement is going to be on prescriptions.
Right.
Where when you're in an Advantage plan, right, we might not see the premium increases that the standalone plans are going to be, but where they're going to see the movement is in how it's going to affect their ancillary benefits of dental, vision, hearing, over-the-counter benefits. I mean, it's good in a way because they've got the health portion to balance out the prescription portion.
Right.
But there's still going to be impact.
And there's even going to be impact on their copays for their health benefits. We're seeing inpatient hospital coverage affected, right? Things that were once a per stay are now turning into a per day, and it's not just the first 2 or 3 days. It could be as much as 6 or 7 extra days, right? Yep. And so, and that brings up the fact that, no matter what kind of health insurance you get when you're on Medicare, whatever you choose, that there are holes, there are gaps, there are co-pays and co-insurances and things that you're expected to pay out of your pocket, but we also have answers for those things too.
Yeah, and again, that's why I would say if there's ever a year that people should be reviewing their coverage, it should be now. Again, I think this is definitely the biggest disruption in the marketplace since what happened with the consent decree about 6-7 years ago between Highmark or Allegheny Health Network, if you will, and UPMC. and could they use each other's networks? And that was regional in nature. This is national. This is Medicare itself. So there's definitely going to be far-reaching implications. You're going to want to read your annual notice of changes, which they should have already received in the mail because now we're in early October, right? They're going to want to read that. They're going to want to make sure that they're reaching out, having a conversation. Now, one of the other big changes this year, and then we'll move on to a couple other things that I do think are important, but also with these changes in Part D, they're instituting a payment plan this year.
Yeah.
What is that about?
So, sometimes people would go to pick up their prescriptions, and when they went in, because they hit the donut hole, they might be seeing a bigger co-payment than they are used to.
Right out of the box.
Right. And so Medicare's open up this opportunity for anybody that's on Medicare can set up a payment plan that will help them to pay for. They'll be able to actually go to their pharmacy, pick up the prescriptions, not have to make a payment there. They're going to be billed by their carrier through, it looks like it's going to be through the prescription drug coverage on your plan, but they'll be able to do that. But that's not really going to work real well for everybody,
No, if you don't have a lot of copays and things of that nature, it's probably not for you. But if you're someone and you're going to hit that $2,000 max, I kind of look at it this way. Like if I know if I'm going to spend a lot of money on my gas bill and maybe I'll budget it out over the year, that's really, really helpful for me.
Sure.
But if I know that, hey, I like my house at 60 degrees and I'm not going to crank the heat up too much, then maybe I'll just pay as I go. And that's the thing. Like some people, they're not going to have the option. They're going to be right into the 2,000 and they're going to decide, do I want to pay that all up front or would I rather pay about $165 a month?
Well, and I think there is some caution because in some cases it might not always be that they divided the whole thing up by 12 months. So even though it's a payment plan, it might not always be exactly the same payment every time. So I guess the word is caution. I would caution people. Anybody is allowed to sign up for that. But then if you miss a payment, they're allowed to actually kind of kick you off of the payment plan. They can't kick you off your medical coverage, but they can kick you off the payment plan. So you're going to have to navigate that really well if that's how you decide to do it.
Yeah, so I think the big thing is changes are coming, right? It's not like previous years where there was a couple of nuances to someone's individual plan.
Yeah.
Sweeping changes are coming to Part D coverage around premiums, donut hole, max out of pocket. It is not the year to sit on your hands and not review your coverage. Again, we work with every major carrier. We are completely unbiased in our approach. And what that means is because we can sit across the table from you and we can offer every single option that's out there, to us, it's about making sure we fit you to the right plan. And quite frankly, I think one of the ways that we really help people the most is on their prescription costs. A lot of times, if they self-enroll through a specific carrier, right, they may be just getting that carrier's best plan, and they haven't actually looked at the whole pie. And that's what we want to do for people.
Yeah, I can tell you story after story. I go into somebody's home, they show me their meds, I do the work right there in front of them, and they were spending hundreds of dollars a month. I was able to bring it down to under $100 a month for all of their medications combined, and they're saving this extra money. I can remember one lady saying to me, now I'm going to be able to save some money to fix up the other room that I've been wanting to fix up, right? Just saving her quite a bit of money. And, you're not always going to get that kind of service from an agent. Sometimes I've heard those stories where somebody did business over the phone, one of those phone numbers they called on from the TV, and they didn't check their meds, they didn't check their doctors or hospitals, and they end up going to the hospital after they get on that plan, and they end up with couple $1,000 bill that they weren't expecting, just because whoever wrote that plan for them, put them on that plan, didn't do the homework they were supposed to do. We'll do the homework.
Yeah. And I think that's super important is, You pick up the phone, 888-818-6334. They can go to MediConnectInsurance.com. They can schedule an appointment over the phone, in person, either at their home or our office. We can do it over a webinar, whatever is most convenient for them. And we can really walk them through so that as they get into next year, they can have complete confidence in their coverage, whether they have original Medicare with a Medigap and a standalone plan, whether they have a Medicare Advantage plan, they can feel really good about their coverage. So again, big sweeping changes coming this year. So let's talk a little bit about details, because I do think this matters maybe for people that are new to Medicare. And what I mean by that is, so someone that is on Medicare and they have one of these prescription plans, they have a Medicare Advantage plan, they can change their plan. What's the time frames during the annual enrollment period?
Annual enrollment period is October 15th through December 7th. We can actually start talking about the new plans October 1st, but you can't officially make a switch. But October 15th through December 7th is annual enrollment period. If you make a change during that time, Lance, it doesn't become effective until January 1st. So you got to keep that in mind. I always think of it as like Christmas shopping. You do all that shopping in October and November, maybe early December, but the kids can't really open up the gifts until December, the end of December, right? So this is the same kind of thing. You're doing all this shopping, the holidays are here, you're celebrating all this stuff. Well, New Year's Day, you'll be able to celebrate that you're on the coverage that's going to get you through that year. I mean, and we downplay this a lot in our society, but having confidence in your health coverage is a huge thing. Yeah. It's a huge thing to be able to rest easy knowing that if I do have a problem, God forbid I have a problem. I don't want to have a problem. I don't want you to have to go to the hospital and use your coverage. But we know how life is, and we know that the older we get, the more we're going to need it. Yeah. So I want all of our clients to have confidence that they're on a plan that's going to take care of them. They're on a plan that's going to have the lowest amount of copays. We can't promise people that they're never going to have copays on some of these plans, but we can say, look, like you said, you need your meds every day, but how often are you having a hospital stay, or how often are you having an MRI? Right? Yep. I've been able to help people when they foresee that they were going to need certain treatments down the road. My mom's a good example. I was able last year, because of some test results, I got her on a new plan for this year, and she had a lower max out of pocket, and that's come in real handy for her.
And that's what, some people are like, well, I chose this coverage. It's been great. I'm happy with it, right. And that's good, right? Yeah. But the truth of the matter is Medicare changes, their health changes. Sure. With those changes, they need to make sure they're making the right decisions. And as much as we're doing these podcasts, we're on the radio every week. Yeah. We're on TV. We're basically everywhere right now, right? Anywhere you want to go, you're going to be able to find us. As much as we're trying to get the message out there, I know what's going to happen. Yeah. January 10th, someone's going to go pick up their medications and they're going to be like, holy cow, what just happened, right? Now, the good thing I will say is if that ends up being you're listening to this today and you just are a procrastinator and you don't end up doing it, and that's you. If you have a Medicare Advantage plan, you're not too late. If you have a standalone prescription drug plan, more than likely you're going to be too late. You are not going to be able to make a change after December 7th. So there are deadlines related to this, and we just want to make sure, again, we can lead the horse to water, right? But we can't make them drink, the old adage. We just want people to know the changes. We're here to help. We want to help. Our services are always free, no cost. We're never pressuring anyone. We're giving people great information to make really good decisions for themselves, and then we can help them if they decide to make a change with that processing of paperwork. Again, super low-key service. So a lot of stuff. We're going to be working a lot of hours, a lot of chaos coming. But if you've taken the time to listen today, we really hope that you'll make the call. Again, it's 888-818-6334. You can go to MediConnectInsurance.com, and you can go to the schedule appointments right at the top of the website. Super easy to find, and you can schedule the appointment that is best for you. Thanks for tuning in today to the Inside Connection podcast.